So it's my pleasure to open up with the first panelist, Kamila Gabe, from the Department of Nutrition at the University of Sao Paulo. Kamila, we are 10 years since the launch of the Guia Alimentar para a População Brasileira. What are some of the main public policies related to NCDs that this guide has accelerated?
Hi, good morning, everyone. It's a pleasure to be here to talk about the food guide, the Brazilian food guide.
You can see your slide.
Okay. My name is Kamila Gabe. I'm a postdoctoral researcher at the Center of Epidemiological Research in Nutrition and Health of the University of Sao Paulo. And I've been working with the food guide since during all my PhD. And it's a very important document that represented a revolution in the way we see the relationship between food and health in Brazil. So we bring some concepts of the implementation and also the context of the food guide in Brazil. So I've divided my presentation in 4 topics. I will start by bringing some characteristics and the political context of the food guide when it was launched in 2014, and then some of its main recommendations and why they are very important for chronic disease prevention and mitigation. And then I'll move to bring the actions for the implementation that were carried out in Brazil since it was implemented in 2014, and then some challenges and perspectives. So I would like to start by bringing that it's very important to consider, to highlight that when it was launched in 2014, this food guide that brought a holistic concept of healthy eating in Brazil, we had a very favorable or good political context. We had a food guide in 2006 that was based on another paradigm of healthy diets. It was based on nutrients and the paradigm of the food pyramid, and we changed it completely in 2014 to bring a more holistic concept of healthy eating. In this period between 2016 and 2014, we had the National Food Policy of Nutrition, Food and Nutrition Security in 2010, the human right to adequate food in the federal constitution in 2010 too, and the national food policy, policy of food and nutrition in 2011. It's also important to highlight that the food guide is a document from the health sector. So the health sector is the sector committed to coordinating and developing international intersectoral actions for the implementation. It is part of the National Policy of Food and Nutrition, the PNUN. And among the guidelines of this policy, the food guide is part of the guideline of the policy for the promotion of adequate and healthy eating. So it's a document used in Brazil for the promotion of adequate and healthy eating as part of this policy from our health system. In terms of recommendation, our food guide brought this for the first time, recommendations totally based on food processing. So it has as a golden rule, always prefer fresh and minimally processed foods and its culinary preparation to ultra-processed foods. So it's basically, it highlights that Brazilian population should avoid this group of foods and prefer our traditional diet based on rice and beans, and that are the core of our traditional dietary pattern in Brazil. This recommendation in 2014 has proved to be very pertinent, because since then we have building consistent and strong evidence on the association between ultra-processed food intake and health outcomes. So now we have this umbrella review of meta-analysis published in 2014, 2024, sorry, this year, showing that the ultra-processed food intake is associated with at least 32 health outcomes. So the prevention of chronic conditions goes through avoiding and reducing ultra-processed food intake. In terms of implementation of the food guide, we in the NUPENS, we proposed this conceptual model for the implementation of the food guides in general, and we analyzed the implementation of our food guide in Brazil according to this conceptual framework. And we highlighted here that for implementing a food guide, it's important to have actions on these two dimensions, which are using the food guide as an educational material to communicate what the country considers a healthy diet for its population, but also to implement, to induce public policies based on the recommendations of this food guide. So in terms of dissemination, when the Brazilian food guide was implemented in 2014, the Ministry of Health made several partnerships with institutions in Brazil to disseminate its recommendations. So many materials based on the recommendations were developed. These materials targeted different settings and actors. So we had some of them were made for promotion of healthy eating in schools. Other of them were for primary health care. So these were made in partnership between Ministry of Health and public institutions in our country. In terms of public policies, the more recent of them was the update of the composition of the National Basic Food Basket through a portaria from the Ministry of the Social Development. So this update of the food basket was completely based on the recommendations of the guide. So we had another food basket before that had a restricted number of fresh and minimally processed items. So this new food basket expanded and diversified the number of these foods. It also valued the country's regional diversity by including different kinds of fruits and vegetables that are part of our biodiversity. And the implication of this is the use of this list of the basic food basket for the exemption or reduction of taxes for these foods that are part of the food basket. We had recently too, last year, a publication of a regulation for the promotion of adequate and healthy eating in the school environment. So this regulation determined that all the actions for promoting of healthy diets, healthy eating in schools environment must be based on food guide. And this include not only actions on nutrition education, but also actions on the provision and commercialization and marketing of food and beverage in schools. One very important change in our law in Brazil based on the food guide was the update of the National School Feeding Program in 2020. So we had this large national school feeding program in Brazil that serves more than 40 millions of meals in Brazil every day. So the change of this law has a very broad impact in changing the meals that are offered in schools. So then this new resolution determined that at least 75% of the money that is transferred from the National Fund for Educational Development must be allocated to purchase of fresh and minimally processed foods. And the acquisition of the processed and ultra-processed foods was limited to 20% of this budget. And finally, when the guide was published, the Ministry of Health published this regulation to prohibit the ultra-processed foods in all institutional environments of the Ministry of Health. So it was prohibited the provision, commercialization, and advertising of ultra-processed food in workplaces linked to the Ministry of Health. Besides the federal level, there's some regulation related to states and municipalities. For example, some municipalities that have prohibited the ultra-processed foods in school cafeterias. In Brazil, some examples are Rio de Janeiro and Niterói. And there is a law project in São Paulo under analysis. In terms of the implementation in the healthcare, in our SUS, our health unified health system, there's this is a project in partnership between the NUPENS-FSP-USP and the Ministry of Health to train health professionals to implement the recommendations of the guide and their professional practices, because as the food guide represents this change of paradigm, it's very important to implement this in changing health professional practices. So it started by the development of these 5 protocols of how to give nutrition, food and nutrition advice to in the individual level in the primary healthcare units in Brazil. These protocols were developed and in a project between NUPENS-FSP and Beneficência Portuguesa under the PROAD SUS program. A course for implementing these protocols were developed and made available in the UNASUS platform for training the professionals. And this was launched this year, this course. The implementation of this course was, this project of developing and implementing this course was a big project and involved visiting many municipalities in Brazil to train and to stimulate the managers of each city to train and to stimulate the health professionals to make the course in the UNASUS platform. So to finish my presentation, I'll just mention some challenges and perspective. So one of the challenges of the implementation of the food guide was the political discontinuation that we had in the past years. So one example of these that have impacted in the implementation of the guide was the extinction of the National Council of Food and Nutrition Security from 2019 to 2023. And this council was a very important actor on the planning the implementation, helping to plan the implementation of the food guide. And it represented the destruction of our health system on food and nutrition security during this period. Also, the conflict of interest in policy decision. The taxation of ultra-processed food is also something that is under debate in our tributary tax reform in Brazil. This was a very important discussion, and now it's under discussion if the taxation of food, of beverage, sugary drinks is been decided. And to finish, the monitoring and evaluation of the implementation of these policies and how they impact the intake of ultra-processed foods is something that we need to pay attention and to strengthen. So thank you, everyone. I'm open to discuss and to answer the questions you may have.
Thank you so much, Kamila. Really impressive, and congratulations to you, to the team, to Brazil. It's really impressive demonstration of systems approach to really addressing this issue. And we hope to come back in the discussion on many of your points, but I just take note of this is not necessarily only a very powerful technical guidance and technical tool to prioritize, design, implement policies, effective policies. But it really is that systems approach where you address, health literacy, health workforce, participatory approaches, and the important opportunity and now challenge of the cross-sectoral coordination and stakeholder coordination, which you had at the beginning. Now you know that may have slightly been weakened, and those are sort of what you're pointing towards, sort of success factors of such an approach that we need to consider. And then the additional challenges, which I think may cut across other presentations on conflict of interest, undue influence, and additional regulatory and fiscal policies which need to support policy interventions on the ground. We need sort of nationwide regulatory and fiscal policies to continue to sustain some of these actions. So maybe we can get back to that because it does touch on some of the other presentations.